I would have to come back to the age of the patient again. And generally in the young population, most of the meniscal tear are treated surgically. On the other extreme, on the older population, I will tend to be quite conservative with the meniscal tear. The dilemma starts in the middle age and with the presence of degenerative meniscal tear. And I tend to look, from taking the history and from the examination, what type of the meniscal tear is it? Is it a degenerative one or is it a traumatic tear? And generally I will tend to give them a number of weeks, 6 weeks, to try conservative treatment. And if that fails, generally when patients come to me would have had that conservative treatment, I will tend to treat them surgically. So I will give you an example here of how I change my algorithm of treating the meniscal tear in the middle age. So the way I look at the meniscal tears is being either traumatic or degenerative. So in the traumatic types, I tend to treat them surgically because due to vascularity of the meniscus doesn't tend to heal on its own. The degenerative ones, the way I look at this spectrum being degenerative versus traumatic, I call the degenerative ones wrinkles and gray hair type scenario. And of course we don't go around shaving our own wrinkles, that would be too traumatic. And that's where I tend to be conservative with the meniscal tears. With the traumatic ones, I call them the stone in the shoe type scenario, and there is where a meniscal tear, it keeps irritating the knee. This clearly will benefit from removing the stone from the shoe, such as the irritant from the knee, and they will benefit from an arthroscopic partial meniscectomy. So the way I look at a meniscal tear when I see it on the MRI is should I leave this tear alone or can I repair this tear? And sometimes I can't repair it, but is it symptomatic enough to warrant surgery for that patient? And this in essence is my algorithm when I talk to the middle age that may or may not remember the traumatic episode of causing a meniscal tear. So this is in essence the way I look at the meniscal tear in the middle age, who may or may not remember the actual traumatic event of causing the meniscal tear. It is the symptoms and how the tear is irritating the knee.